Hello, my name's Jonny, and welcome to the Listening Events, a video and podcast series capturing conversation between junior doctors, shedding light on our lives, challenges, and career aspirations. Today, we're discussing different career paths within medical training, and I've got three panellists with me who've all had varied career paths. Myself, I'm a F2 at QMC, having qualified just less than two years ago. I'm at the start of my career journey. So let's meet our panellists. So we've got Alex, who's at ST6 in plastics and also Chief Registrar of Surgery. Hello.
Hi.
And we've got Chris, who's ST6 in orthopaedics, currently doing a PhD.
Hi.
And we've also got Rachel, CT2 in anaesthetics.
Hi.
So Alex, tell us about your training path and becoming Chief Registrar.
So I have done a relatively standard training pathway up to now, ST6, but the last year I've been 60% clinical and 40% out of programme doing a management and leadership role as Chief Registrar for Surgery for Nottingham. And that involves me supporting my colleagues, attending high-level meetings in the Trust, learning about the NHS, and then doing big projects to try and improve quality and training and all that kind of thing. So it's been quite a useful segue outside of training because we have to do that experience as part of our role anyway.
Fantastic. And Rachel, I understand you took some years out before you went into training. Tell us about that.
So when I finished F2, I think I knew I wanted to do anaesthetics, but also knew I really wanted to go abroad and have a bit of time out, especially after COVID. So I initially did a sort of fellow year in critical care at QMC, and then ended up going to Wellington. I'm in New Zealand for sort of the latter part of my F3 and for the whole of my F4 year. It was sort of, I think having time out was really important for me, and I felt sort of really refreshed and ready to start training when I did return. I had kind of time to strengthen my application, but also a lot more flexibility to commit to other things outside of medicine and also travel.
Awesome. And Chris, as a less than full-time trainee, what made you choose to do that?
I largely chose to be less than full-time to support my family. It's meant I can be more present at home and has been helpful with some of the childcare associated costs. My wife also works, and so it's meant we can be more flexible and support her job when things get intense or she has more time there. And there's an element of longevity. The career is very long with periods of high stress and high intensity. And I think working this way helps me stay in the career longer and mitigate some of the possible effects of burnout.
And do you think there's any stigma attached to being less than full-time?
I think that's quite tricky to say at a general level. It will vary by department, and the culture that the leadership within that department develops will be key. There is a perception that less than full-time trainees are women who are taking less than full-time training as an option for childcare. And whilst that's common, that's not the only reason. And certainly with the changes in the rules recently, you can do less than full-time training for more and more reasons. I think it can depend on what percentage you're working, that people can feel that they're not as clued up on the situation of their patients or department because they're in the building less. And largely that can be mitigated with good handover and acknowledging that that can happen. And finally, there are sometimes some issues of feeling isolated as a less than full-time doctor because it takes longer to build up those working relationships with your colleagues and the people you work with on the wards. And that can take longer to flourish. And in general, everything does just take a little bit longer. Rachel, are you worried about things taking a bit longer or too long taking time out of training?
To be honest, no, not really. I think at the time when I was applying to go abroad, I was more concerned about making sure I got into a training programme to kind of return home. And now I think, I do consider about being out of sync and how this would potentially affect later choices. For example, if I wanted to start a family, and whether I'd want the security of a reg post first. But I think, your priorities change quite a lot at different points in your life, and everyone's really different. And I really sort of appreciated the flexibility that it gave me. And that sort of was a good enough balance for me that you kind of had less stability, but gained that flexibility. I think, I was in a really lucky position that I was able to just up and leave and go to a different country, and not everyone can do this. But hopefully I think there's a shift towards making training work around your life rather than completely dedicating your life to training, which is really positive. And I think, kind of back to your original question, I think ultimately we'll be a consultant for 30 plus years, and 1 to 2 years out of training I don't think will make a sort of significant difference. and actually might increase the longevity of your career if you're sort of less burnt out and you've done some more things that you wanted to do during your training.
That's really interesting to hear some of the positives and some of the challenges of those different training options. And Chris, you mentioned a little bit about generating the right culture within departments. And Alex, how do you think the workplace culture affects the career paths that trainees take?
Yeah, I think that historically there has been a perception that less than full-time are a less reliable workforce, and certainly for women, you've got children, you might be a less reliable employee. But that, I think, has changed. And like Chris was saying, with the new rules, you can go less than full-time for any reason. I think there's been massive improvements in that area. Again, I agree that I don't think the time extra on top of your training makes a big difference to people. My decisions now about whether to be less than full-time or full-time are more around how it's going to fit in around my family, and worry that if I take a day off a week, that I'll fill it with all the other obligations that we have, like doing the courses and research projects and audits and all the other bits that we have to do. I don't want my day off to be doing that. And
Rachel, in your experience, have you had any support from consultants and supervisors with your decision making to take time out of training?
Absolutely, and I think I've been really lucky so far, and I think definitely anaesthetics as a specialty is sort of really proactive in kind of encouraging time out of training and other options as part of your training. I definitely had a lot of support kind of prior to going, so I found there was a lot of consultants that had actually been abroad one way or another as part of their training, and sort of were really enthusiastic and encouraging, and sort of reassured me that actually you'll still be a consultant at the end of it. But equally, when I came back, I think I found the transition quite difficult, but I got a lot of support from my kind of educational supervisor and also other trainees that had done the same thing, because I definitely kind of wasn't the only person in my situation at all, so it was really good.
Chris, what other ways can consultants be supported, in particular in less than full time?
I think largely being aware that training and working patterns are much more varied than they used to be, and that talking about that and being aware of it. I think there is, as we were discussing, an impact on your clinical work, but also on your portfolio work as a doctor. And so when supervisors are making training programs with doctors or trainees, I think it'd be really good to acknowledge that and be very clear about what is expected within a less than full-time training environment, so that you don't try and do full-time competencies or equivalents within a less than full-time rota.
That makes sense. And Alex, as someone that's nearing consultancy, when you are a consultant, what are you going to do to support your trainees?
So I think we're now accepting that happy people and happy trainees benefit everyone, benefits the patient, benefits the trainee, and it benefits the entire team. So I want to be able to support people that are working in my department to actively look out for those opportunities that will suit them, to feel comfortable that they can take any kind of work-life balance, any kind of less than full-time percentage that suits their lifestyle and their family, and then everybody's happy. Fantastic.
Well, thank you all. It's been great to hear about some of the standard training paths, less than full-time options, and also time out of training. And so thank you all for your input.
Thank you.
Thank you.
Thank you.